So good evening and welcome to our lecture series to support healthcare providers on resiliency, health, and well-being, sponsored by the PI and New Beta at large chapters of Sigma, the Johns Hopkins University School of Nursing, and the University of Maryland School of Nursing. My name is Paul Thurman. I'm the president of the PI chapter. This series was inspired by the work of Dr. Cynda Rushton and the team of R3, the Renewal, Resilience, and Retention of Maryland Nurses Initiative. Tonight, Dr. Rushton will be presenting the R3 program update and strategies to promote well-being. So this is part of our mission to develop nurse leaders anywhere and to improve healthcare everywhere. And I believe that kindness is at the heart of nursing. And so now it's with my great pleasure to introduce Dean Yolanda Ogbalu, the Bill and Joanne Conway Dean of the University School of Nursing.
Thank you so much, Dr. Thurman, and thank you for your leadership as president of the PI at Large chapter. It's my great pleasure as Dean of the University of Maryland School of Nursing to welcome everyone to this event. I especially want to recognize our partnership with colleagues from the New Beta at Large chapter at Johns Hopkins University School of Nursing. Today is another portion of our series of joint lectures led initially by James Kirschland along with Hopkins University. Once again, we have an opportunity to bring together our respective chapters to learn about an important scholarly topic that has really significant implications for our professional lives today. Before I introduce our speaker, who many people may know, Dr. Cynda Rushton, I would like to comment that the overarching theme for this lecture series, Resilience, Health, and Well-Being, has been an area of focus for our joint lectures for over 2 years. In fact, the theme was launched with a talk by Dr. Rushton to our joint audience in March of 2021. Since then, I think that our understanding and appreciation of resilience has only increased. We've experienced the fallout of the COVID-19 pandemic, and most especially the pressures that it has caused on the nursing workforce as it struggles to deliver excellent and compassionate care. We are clearly at a critical juncture in terms of the needs to better support the lives of nurses professionally and personally, and this includes fostering well-being, resilience, and our health. I can think of no one better than to give us guidance on how to do this than Dr. Cynda Rushton. Dr. Rushton is well known to many of us, but it's always important to pick out a few quick points about her background. Since 2012, she has served as the Anne and George L. Bunting Professor of Clinical Ethics at the Berman Institute of Bioethics and School of Nursing. In 2016, she co-led a national collaborative, State of the Science, Transforming Moral Distress into Moral Resilience in Nursing, and co-chaired the American Nurses Association Professional Issues Panel that created a call to action, exploring moral resilience towards a culture of ethical practice. More recently, she's the author of Moral Resilience, Transforming the Moral Suffering in Healthcare. We all know her through her work in strategic leadership through the R3 Renewal, Resilience, and Retention for Maryland Nurses Initiatives, funded by the Maryland Higher Education Commission. Is a statewide initiative to build resilience and ethical practice in nursing students and new nurses. She received her PhD from Catholic University, her master's from the Medical University of South Carolina, and her BSN from the University of Kentucky. As you would expect, she is the recipient of numerous awards, which I will not detail. I want to thank her for joining us once again to explore this critical topic, and I know that this will be an important and fascinating presentation. Please join me in extending a warm welcome to Dr. Rushton.
Thank you so much, Dean. Ogbolu, right? Is that right? Have I said it right? Ogbolu?
Yeah, it's like the G is silent. So
Ogbolu.
Ogbolu. Yeah.
Ogbolu.
Thank you.
Beautiful. So it's really a pleasure to be here again and to share what we are doing in the state, because there's a lot going on. And as you mentioned, it is really an important time for us in Maryland, but importantly in our profession, to be thinking about how do we actually meet these challenges that are in front of us. And I am here really on behalf of my incredible colleagues and at Hopkins, Vicki Hughes, who you all know from the Sigma chapter, Krisha Hudson, Sandy Swoboda, Aaron Wright, Nancy Reller, and Rita Doust, and also Ginger Hansen and Danielle Boyce, who are our data folks behind the scenes that help us try to use our evidence to support what we're doing. So I just want to really acknowledge them and the support of our NSP to grant mechanism here in the state, which is really a gift to all of us to be able to do this important work. So I thought it was really important for us to just pause for a moment as we start tonight. We have journeyed through some really challenging times in nursing. And one of the things I know about nurses is nurses show up when things are difficult and when things are joyous. And this particular time in our history has left some wounds and some questions that I think are really important for us to pause and reflect on right now. But before we sort of launch into the idea of how do we stay buoyant in the midst of all this, it feels really important that we just remember why we're here. Remember why we became a nurse, why our service really does matter to so many people, and why our work right now is so important. I was earlier today doing a podcast, and we were talking about how nursing is really a social good. It's like water and electricity in our healthcare system. It cannot function without us. And so it's a really important time, I think, for us to claim our place in the healthcare system and in society, and how important our contributions really are. So to kind of take that theme forward, I wanted to share this piece by Haruki Murakami, who wrote this piece on the storm. And once the storm is over, you won't remember how you made it through, how you managed to survive. You won't even be sure, in fact, whether the storm is really over. But one thing is certain: when you come out of the storm, you won't be the same person who walked in. That's what the storm is all about. So I want you just to kind of hold that thought of the storm that we've been through, that we are not going back. We only have the choice to go forward. So I want to share a little bit about what we've been doing, and to acknowledge again all the people who have been part of this amazing group. Our coordinating council, which is representatives from this Champions Coalition, which includes 8 schools of nursing, 5 hospitals, and of course our Maryland Nurse Residency Collaborative. Our core team I've already mentioned, but we also have a really amazing National Advisory Board that represents many national nursing organizations that have been invaluable in helping us to think about how do we contribute to creating a healthier work environment and creating the conditions for nurses to do what they do best. So here's a little bit of I'm going to just take you through a lot of the things that we've been doing, and I want to leave some time for us to have some dialogue about where the challenges are and what else might be needed, especially right now. So we had three big aims to look at how we could build a multi-pronged educational program and organizational based interventions, and to really create a learning community within Maryland with nurses across the state to think about this question of how do we renew and really invigorate nursing. At the time when we submitted this grant, we didn't know anything about COVID. It was an idea that apparently whose time came in very important timing during the COVID pandemic. Our mechanisms for this this grant have involved immersion workshops where we have recruited champions from our 8 schools of nursing, where we have given them some foundational content, where they've integrated the modules that we've created into their programs and used them as a means for system transformation. We've also been working with our 5 hospitals and their NRP representatives, most commonly through our NRP collaborative, but developing some communities of practice so we can really learn from each other. And I'll tell you a little bit more about some of our tools and some of the resources we've developed. So we started first with our champions. And these were academic and faculty members who were recruited from our partner organizations, and they completed a 3-part series that we completed this last May. And what we found was that it was really important for faculty who were going to teach the content related to ethics and resilience and self-stewardship, that they should actually have the skills and tools themselves. So we started out with focusing on these 3 areas of values and integrity and its relationship to resilience, and the tools of mindfulness and self-stewardship, as well as emotional intelligence, as key elements of helping faculty to achieve really alignment and well-being in the process. So here's just some really basic information about how our participants responded. Most of them were really actually pretty satisfied with the curriculum that they experienced. And the majority would recommend it to their colleagues. They found that it helped them to improve their well-being and to be more closely connected with their values. And one of the really important things for me was that people enjoyed themselves. It wasn't the kind of experience of you know, being a passive learner. Everyone was very fully engaged. And then you can see some of the things that really stood out for them. The importance of networking with our peers. And one of the things we know for sure during the pandemic is how isolated so many of us felt. So to be able to even come together in a virtual framework and to be with people who cared about the same things we did really, I think, was an important component of this whole champion program. The idea of acting with integrity and noticing where our mindset is focused and how we can let go of things that no longer serve us were practices that stood out for many of the participants. And I think part of that is the conversations around our values and what we stand for are not routine. They're kind of taken for granted. And so to have a chance together collectively to reflect on who we are and what we stand for as nurses was a really, really important component of that. And also giving people some skills and tools about how they can focus their attention through mindfulness, and giving people permission to let go of the things that actually are in the way of them being the person or the nurse that they want to be. This just gives you a little taste of the things that they were committed to continuing, reflecting the things that were probably most that they were most enjoyed learning about. But what we came away with, I think, was a very important message, and that was this whole program is about strengths. It's not a deficit model. Uh, we really approached it as one of our colleagues in practice, Jen Simmons, said, we are all resilient and courageous. Sometimes we just need the tools and support to access what's already inside of us. And that really was the sort of guiding principle for this program, is there's nothing wrong with anyone. It's that we've been in situations that have exceeded our thresholds of being able to meet them in a healthy, wholesome way. So the second part of this, and this is a pretty busy slide, but the reason it's so busy is that all of these titles in the boxes here are modules that we've created based on these 3 buckets that we started with our faculty champions. And all of these modules are designed to be short opportunities to integrate content into existing programs. So whether that's a pre-licensure program or a graduate program or an NRP program, they are specifically designed to be able to be easily added in and incorporated into existing programs. And you'll notice here, we have a number related to mindfulness and emotional intelligence, as well as a whole bucket on values and integrity, what it takes for ethical and healthy workplaces, as well as just the ideas of how we take care of ourselves. So where we are right now is we have our faculty champions and our NRP colleagues who are integrating these modules into our courses. And I'm teaching this particular session of courses, and we've integrated 5 of these modules into a 4th semester pre-licensure program. I know our colleagues at the University of Maryland are doing some terrific work aligning their efforts around social justice using many of the modules that we created through this program. And so that, in addition to our NRP colleagues using many of these in nurse residency programs, we also collaborated with our nurse residency consortium, and we developed 4 specific modules just for new nurses. And these focused on things like giving and receiving feedback, addressing hard things like the first code or your first death or medication error, and how do you process those, what it means to belong, and how we can really cultivate our own belonging in the organizations where we are. And then we also focused in on how do we ask for and receive support? Because we know as nurses, we're not very good at that. And so we felt like that was a skill that new nurses in particular needed to learn. And oh, by the way, all of us do. But that seemed to be a real gap for them. So that was one that we developed as well. So I'm going to invite you, if you have your phone, to take a look at the website. And when you go to the website, you can scan here on this QR code, you'll see that there are lots of resources on the website. All of these modules are under tools. And when you go to the website, you'll be able to access these tools. You have to complete a user agreement, but once you've done it, you should be able to come back again and again. We also have, in addition to the modules that I referred to, is we created some digital assets. And you'll see a tab for social media and digital assets. These are small communication tools with specific messages that relate to our resilience, our ability to meet those challenges in ways that are healthy and wholesome. And we've created them for you to use any way you want. So there's formats for, if you're doing a social media post, they're formatted in different ways so that you can just easily click on them, copy them, and send them wherever you need to, whether it's a newsletter, whether it is in a social media post. And we really invite you and encourage you to use these. I think the more that we can repeat some of the similar language and narrative, the more that we can begin to try to shift the way that we think about ourselves and how others think about us. So I encourage you to just take advantage of those, use them anytime. This is a great one. We're almost to Halloween. Don't let the seasons deplete you. Take time to recharge. So whoever you think needs to hear that, feel free. The other thing we have been doing is the Resilient Nurse podcast, and I would encourage you to take advantage of listening to those podcasts. We have 6 that we've completed, and we have 6 more in production. We actually just did another one this morning that focuses on the social contract and thinking about how we might shift that to a social covenant with the public. And we had Susan Reinhardt as our guest. So all of these episodes are on the website, and you can take advantage of those and hear from your colleagues about how they're really creating lots of innovative ways to support nurses in many different settings, including students and faculty. So now I have an offering for you. One of the things that we did in the very first year of our grant is we did a process called a Wiki Wisdom Forum. And we invited people from nurses across the state to help us think about where were the gaps between nursing school and practice. And from that, we created a report called Mind the Gap. When students were involved and faculty, we came up with some recommendations about what we might do to address that gap. Well, now we're in year 4 of our grant, and we are using a different technology called Slow Talk, which is a dialogue platform that is really innovative. And we're inviting nurses from around the state, whether they are nursing students or nursing faculty, whether they're nurse residents in that first year, or they've been in practice for any period of time after a year, to participate. So you can see here's a QR code where you can sign up. There are limited spaces, but we really want a diverse group of people to help us shape the narrative about what it means to be a nurse now. What has been and where do we want to go? How do we want to be known and understood as nurses? I think we're at a real tipping point in our profession right now, and it's going to be really important for us to be part of crafting that narrative rather than having it served up to us. We actually can be part of defining how we want to be known and understood by our patients, by our leaders, by healthcare organizations, and the broader communities. So I would encourage you, if you have any interest at all, scan that QR code and join us. These are small group conversations. They're audio only. They can be done from anywhere, and they will be held at different times during the beginning of October. So think about it and join us, because your voice is really important in this process. We want to hear from you. We want you to see yourself as being part of creating the future that we want to have for ourselves and for our patients. And then the last thing is save the date. In May, on May 2nd, which actually happens to be my dad's birthday, we are having our statewide conference. We're going to have it again at Mount Washington. It'll be from 10 to 3:30. And we will be sharing what we've learned, but we also are going to be inviting you to think about what have you been doing and how can we come together and really learn from each other about what's happening in the state, but also how we can be part of this important time in our profession to really determine what our future is going to look like. So I think I'm going to pause right there for a second and see if we have any comments or reflections or anything that you'd like to share or think about together in the time that we have. What are your thoughts? What are your challenges? What's on your mind?
Thank you very much, Dr. Rushton. So the term resilience gets sort of thrown around a lot as sort of a buzzword lately. So what would you say to the staff nurse who is maybe, been at the bedside for, the last 2 or 3 years, and, the hospital says, we want to help you with your resiliency, and, here's a PowerPoint, or here's a podcast or something. I don't think that's very effective in building resilience. I know from myself personally, resilience has been something that I've had to sort of develop on my own internally, and it takes work to get there.
It does, but you know what I would say to everyone? You are already resilient. This is not uh, a statement of something that's lacking in you. I think all nurses are resilient. You wouldn't be a nurse if you weren't. And so I feel sometimes that words like resilience get corrupted from what they actually are meant to reflect. And in a very basic way, resilience is it's the resources we have within ourselves and around us to meet challenges. And to sometimes it is just to be able to stay in the boat is being resilient. And sometimes there's the possibility that we might even grow as a result of the hard things that we've confronted. But both of those, I think, have a tone of hope. That if you think about our work as nurses, we didn't choose the easy way. Taking care of people in some of their most vulnerable periods of time and some of the most complex kinds of situations is not the easy way. And so that's why I say, nurses already have the sort of the infrastructure of resilience. Sometimes, though, we do need some help to access those resources. And I think what we've seen in COVID in particular is it's not because people were deficient or weak, it's because the circumstances exceeded everybody's capacity. It was a situation where we really didn't have the resources that we needed to meet those challenges. And it's not because we didn't try. It's not because we weren't smart enough. It's not because, we were somehow deficient. It's because the circumstances were so intense that it really wasn't realistic to expect people to be able to sustain the kind of energy, the kind of focus that was needed for more than 3 years. It's just not humanly possible. So that's what I'd say.
I agree with you. The amount of innovation and resourcefulness that staff used to take care of all of those patients during COVID, I think, is a testament to the amount of strength and courage that we all have. And as long as we don't stifle people's innovation and give them the ability to, the latitude to go out on a limb and do things a different way, because that's what the circumstance calls for, I think is a testament to that.
Yeah, and I think, you mentioned innovation. I've always said if you have a hard problem, give it to a nurse because nurses are innovators. We are problem solvers. We are well trained in so many ways to meet these challenges. And what we saw during COVID was, nurses really did figure out in many, many ways how to meet these challenges. At the same time, I think we also had to confront our limits. And, nurses tend to put their needs aside for the benefit of the people that they're serving. And that is not a sustainable strategy. We saw that as we saw people becoming sick themselves, becoming exhausted and burned out. And at the same time, I think part of the reason for the design of this particular initiative is that we have to intervene both at the individual level and at the system level. That there are clearly things that people need to invest in themselves to be good stewards of their own resources. But at the same time, we need to dismantle the systems that are causing the exhaustion and the depletion too. And so it's not an either or, it really is both and. And those interventions are going to look slightly different, but it's important to make sure that we're doing both and that we're taking seriously the importance of system redesign so that we don't find ourselves in this situation again.
Thank you. In the chat, Mary Galway has asked, can you talk a bit about how the Slow Talk recording will be used to create tools or resources for nurses in their practice?
So that's a great question, Mary. Part of our focus with Slow Talk is to try to engage nurses in thinking about how they see themselves right now. And one of the motivators for that is I feel like we are in kind of a identity crisis in nursing right now. We're trying to figure out who are we in this post-COVID world and how we talk about ourselves to each other, how we talk about ourselves to the public, our patients, to our leaders matters. And so this is a process of trying to help us see what is that future we want to create. And by doing so, it will give us some clues about what needs to change, what are the things we need to invest in to create the environments where nurses really can practice at the top of their license, where nurses can be the, most respected and ethical profession, but to feel that we have created the environments where that's possible. So that's what we're hoping to uncover through this process. It's an hour-long investment. What we've heard so far from people who have participated is it's been very engaging, and people have really appreciated the opportunity to feel heard, to feel understood, and to be in the company of their colleagues in this particular way.
Thank you. Are there any more questions? If you do, just please put them in the chat, or you can raise your hand. And I think we can unmute you, right, Andy? I think we can.
I can't really see who's raising their hands, so I'm hoping you can.
I can. Right now, there's nobody really that's raised their hand other than Mary.
So I guess if I were thinking about, reflections about where we've been, this is an image that I come back to again and again. And this is an image of a piece of broken pottery. And in Japan, when a piece of pottery is broken, instead of throwing away all the pieces, there's a practice called kintsugi, or golden repair. And golden repair takes golden paint and cement and takes the pieces of pottery that were broken to put them back together in a new way. And instead of turning away from the broken parts, it's really an honoring of the parts that were broken. And I think that's where we are right now in nursing. We have been through a period of time where our assumptions about our work perhaps have been shattered. Our dreams in some way have been shattered. And yet here we are at this pivotal point. How do we bring all those pieces back together and not pretend like nothing happened, but rather to actually turn toward them and to say, yes, that was a very difficult, challenging time. There were incredible consequences for everyone, including nurses. And how do we honor that by putting them together in a way that allows us to move forward? Because the public, the people that we serve, the people we have a social covenant with, need us to be whole. They need us to be able to help shift these healthcare systems in ways that actually will serve them, but also will serve the people who are taking care of them. And that includes the 4 million nurses in this country. So I would invite all of us to just take a moment to pause and reflect on where we've been. We are not the same. And yet there are broken parts, and those broken parts also can be healed. And I think that's a big part of our agenda right now, is to try to figure out, how do we heal? How do we heal those wounds? How do we come together as a community of nurses? And how do we speak with one vision and one voice for the future? So that's my challenge for everyone. And I'm hoping that maybe we could take a minute or two and just hear from people about, what do you need to be able to be whole? What's missing? And what would it look like if you were successful? So if you have thoughts about that and you want to put them in the chat, or if you'd like to unmute yourself, we'd love to hear your thoughts.
Hi, this is Yolanda Oberlu. I just wanted to say thank you for this. I really love this analogy, thinking about re-cementing the profession with gold. I was thinking about resilience and, in the work that I've experienced around resilience. Resilience happens as a result of a traumatic experience, and people are broken. And so I've been thinking that through, and just seeing this image really brings a lot of value to that, right? How do we take the trauma that people have experienced and begin the healing process? So it's not so much a question, but just a comment, just a beautiful way of thinking about how to re-cement the profession with gold.
Yeah, I love the idea of re-cementing the profession with gold. And you're right, strength often comes out of adversity. And, boy, some people have experienced a lot more than others. And so we've now had a collective experience of adversity. And what have we learned? How do we use that to really take us forward? So I really appreciate that thought. Are there others? Anybody else has?
Mary just stated, you grow through what you go through.
Yes, you do. You sure do, Mary.
Anyone else?
Well, I would just say this, you know, this project has really been a labor of love for our profession, and we, really hope that you'll take some time and noodle around on the website and find some things that might be useful to you. Try out some of the modules. If you're an educator, there's facilitator guides to help you. We found that they've been pretty accessible for students and for new nurses. And, together they can start to create a ripple effect where we don't see ourselves as being deficient, but we see ourselves as being empowered and strong to meet these challenges. And that sometimes we actually do need a little bit of help, and we need the support of each other. We need the support of our organizations, whether it's schools of nursing or healthcare organizations or our professional organizations. But we're not alone. And that is an important part of this healing process, is for us to really come together. So I hope you'll consider being part of our slow talk, but also to join us in May for our statewide conference. And let's use it as a time to celebrate the incredible contributions that nurses make every day.
Thank you so much, Dr. Rushton, for your experience and for sharing with us the activities of the R3 program. My challenge to all of the participants is, how do we get this message to more than just those in the School of Nursing and to the individuals in the residency programs, because there are lots of nurses out there who are at the bedside who need access to this information as well. So I encourage all of you to share these resources with all of your colleagues and to your friends, because one of the best ways to get things to people is the grassroots of each other.
Totally agree with that, Paul. And share shamelessly. That's why we created the way that we did, and they're freely available within Maryland and actually belong beyond that. But please do use them. We certainly don't want them to sit on a website. We want them to.
They don't do any good if they're just sitting on a website.
No good there. So we look forward to hearing how you have used them and hopefully what difference they've made.
Great. Thank you. Is there any other final thoughts from any of the participants? Jen Goldsmith has said that her hospital is going to start quarterly preceptor support sessions, and she's going to check out the R3 resources because she would love to fold some of them into those sessions. And Laura states that, thank you, love your work in the podcast. She's asking if there's a cost to the register for the conference.
No cost. You just have to register and show up. That's it. That's all you got to do.
Little heart emoji.
Yeah.
Thank you.
It's wonderful. Spread the word. That's your job. Spread the word like fire.
Absolutely. Thank you so much, Dr. Rushton. Thank you, Dr. Obalu, for joining with us. And we look forward to seeing everybody at the next resiliency presentation.
Thank you so much for inviting me. It's really a pleasure to be with all of you and to do this important work.
Great. Thank you so much. Thank you, everybody who came.